Thank you, Dr. Lilburn. And I'd like to first, before I'd like to thank Dr. Lilburn for bringing attention to this mycotoxin topic and, leading this session. And hope you are not, your brain is not saturated because you have been listening so many, talks. And mine is going to be the very last. So with that, I'm going to talk about the understanding and combating mycotoxins for sustainable poultry production. Before we go into that topic, I just wanted to give brief introduction about why mycotoxins matter to the poultry industry. To understand that mycotoxins' importance to the poultry industry, we need to understand that major economic drivers to the integrated poultry system. Feed, when we think about the feed is one of the major cost component, approximately 70 to 80% of the total production cost. When we think about that feed, corn is the primary feed ingredient, constitutes 60 to 70% of that total feed composition. So when we look into that, this table, you can see that corn, soybean based diet is a standard feed. You can see that 56% of the corn is involved in that feed composition. In some extreme cases, for example, just a pure corn-based diet, 72% of the corn comes involved in that feed composition. So feed is the major component introducing that mycotoxin into your poultry flock. But these feed components, majority of the feed components, contaminated with these mycotoxins. The literature says that we have somewhere 20,000 to 300,000 of mycotoxins, in the field. But irrespective of that number of estimation of these mycotoxins, these are all the major mycotoxins in the feed ingredients. In addition to that, as the previous speakers they were talking about this, in addition to that major mycotoxins, we have this, masked or modified mycotoxins. This modification can be happened anywhere in the animals or by plants, sometimes within the fungi itself. In addition to this modification happens, chemically. Sometimes the chemicals, they modify this. In addition to that, the temperature also modify these mycotoxins. So let me show you the big picture of mycotoxin occurrence at the global level. It looks like these mycotoxins have formed a global alliance. Every country out there facing challenges with these mycotoxins, and our home country is no exception. This climate change significantly increased the mycotoxin occurrence and put the United States at extreme risk. The estimated economic loss due to this mycotoxin is $900 million. So we have guidelines for these major mycotoxins in the poultry diet. If you look into that FDA guidelines, we have guidelines for DON, fumonisin, and aflatoxins. For example, DON, we have 5 milligram per kg diet or 5 ppm. And for fumonisins, we have, according to FDA, we have 50 milligram per kg diet. But for aflatoxins, 0.1 milligram per kg diet. But for zearalenone or ochratoxin, T2 toxins, the guidelines hasn't been established yet. But when you look into that EFSA guidelines, the numbers are pretty low than that the guidelines, FDA guidelines, pretty stringent. But here I would like to point out that these guidelines are for just a single mycotoxins. If the feed is contaminated with just a single toxin, following guidelines is not a big problem. But the previous speakers, they have mentioned about that the feed is not always contaminated with single toxin. For example, here is the survey data from DSM. As you can see that this North American corn, you can see that fume, DON, and zearalenone contamination is most predominantly in that North American corn, with 92% of the tested samples had more than one mycotoxin. So following this guidelines is little bit tough for us. Because of that, mycotoxins are not always comes with a single mycotoxin contamination. It always comes with multiple mycotoxin, and this multiple mycotoxin and their synergism or additive effect are all not always considered in the legislations. And the another limiting factor is that the masked mycotoxins, it threw us off the curve. But as the previous speakers, they are all mentioned about this masked mycotoxins have equally important or negatively affects the chicken production performance. In addition to that, we don't have that international guidelines for the mycotoxins. So it's very difficult for us to manage these mycotoxins effectively. So in addition to that, we have some other limitations as poultry finished diet. When we look into that, we include minimum 20 ingredients. So just testing single feed ingredients will not give us a full picture of this mycotoxin concentration in the poultry finished diet. In addition to that, how we test that feed ingredients? Are we going to test on that periodically or in an ad hoc basis? If you test your feed on ad hoc basis, definitely we are going to miss intermittent feed batches. So that may contain more mycotoxins. On top of that, the feed matrix in the test kits, what we are using is for just testing single feed ingredients. For example, if you use the testing kit for testing mycotoxins in the corn sample, you cannot use the same thing to test it in the wheat or soybean. This is not going to give the exact mycotoxin contamination. So basically, you are going to get an underestimation of the mycotoxin level in the feed content. And the next important thing is that the limit of detection, we always set it high for practical purpose. Those things that will give false negative results in the feed. And in addition to that, Dr. Arnold, he told me, he gave that a little bit standards for that masked mycotoxins, but majority of the masked mycotoxins, we don't have the standards. So it's difficult for us to quantify this masked mycotoxins. And another thing is that feed sampling error for testing. How, when we go into that batch, how many feed samples we are collecting for feed testing these mycotoxins, also really important. And the another thing is that the moisture content in the feed. So we have to pay attention to the moisture content because these mycotoxins are diluted by the moisture. So sometimes, even though the mycotoxin level will be high, because of that moisture, it diluted, that will give that low level of that mycotoxins. So we have to pay attention to that moisture level. Otherwise, if you have the moisture level, you have to go back and recalculate that mycotoxins. So this, these mycotoxins basically target that different organs in the chickens. In my opinion, this nutrition, gut microbiome, gut immune system are three pillars. They are all dependent on each other. If you modify one system, that inversely affects that other system, so overall it decreases the production performance. But in our case, these mycotoxins contaminated in the feed, it targets that different organs like a liver, kidney, intestinal cells, and overall immune system is also compromised. So overall it decreases the animal production performance. But in the, why these mycotoxins, what is the real impact of mycotoxins in the chicken health? It sounds like an easy question, but it's really complex to answer to this question. Why? Because when you think about that broiler chickens, their lifespan is 42 days. But they don't, what if the chickens are being fed continuously with low level of multiple mycotoxins? They don't have enough time to show the clinical symptoms of the classical signs of fatty liver or this oral beak lesions. And on top of that, the co-occurrence of multiple mycotoxins make the diagnosis of mycotoxicosis very difficult. And how these mycotoxins, the birds, when they consume these multiple mycotoxins, how the chicken deal with this kind of mycotoxin contaminated diet. In general, the microbes, they have some ability to detoxify these mycotoxins. But unfortunately, this microbial degradation happens at that last part of that intestine, happens at the ceca. By the time this mycotoxin contaminated diet, would have damaged that primary absorption site. So this, microbial degradation is not much beneficial to the chicken. On top of that, this chicken, the mycotoxins bioavailability is different between different mycotoxins. For example, if you take this aflatoxin, it's 80% bioavailability. That means 80% of the aflatoxins absorbed by the system. But when you look into the DON or fumonisin, DON 5 to 20%, fumonisin is 1%. So if the toxins, if they have a poor bioavailability, they will be sit in the intestinal lumen and target the intestinal epithelial cells. But irrespective of whether they absorbed by the system or they don't absorb, if they have that higher bioavailability, they will absorb and then they re-enter into the intestinal lumen through hepatic circulation. So whether they absorbed or not, the intestinal epithelial cells exposed to these toxins at a higher concentration. So what would happen, as I said before, these intestinal epithelial cells are exposed to these toxins. The intestinal barriers are heavily compromised. Because of that, basically they target the tight junction. So these tight junctions are really important to maintain that pathogenic bacteria or toxins not to enter into the circulation. But these toxins target the intestinal epithelial barrier that's heavily compromised and cause leaky gut syndrome. So that the, all the pathogenic, they provide some substrate for this, foodborne pathogens, and also these foodborne pathogens translocated into that systemic circulation and cause some onset of some infectious diseases like salmonella or necrotic enteritis. We had done some 6 big trials. We collected samples only from that control group and necrotic enteritis positive group. You can see that the necrotic enteritis lesion score was not similar across all the 6 treatments. So when we tested the feed samples, the mycotoxin, all the 6 trials was repeated at the same environmental settings. The only difference was that feed. So when we tested that mycotoxins, the mycotoxin levels were different between all the 6 treatments. So this reflected on that necrotic enteritis score and also that gut integrity. So our next question was that because of that, our next question, whether this co-occurrence of multiple mycotoxins, when we feed this to chickens at a subclinical dose, whether they can cause that necrotic enteritis even without the coccidial pathogen. Our question was that whether this combined fume and DON had enough to cause damage to the intestinal epithelial cells so that can cause that necrotic enteritis. So we used even 3 milligram of fume and 4 milligram of DON, which is much less than recommended level. So you can see that on day 14, this combined fume and DON decreased the body weight gain by 39 grams, and this trend continued until day 35, where this combined fume and DON decreased the body weight gain by 84 grams, which is approximately 8% of that total body weight, just because of fume and DON. We also measured that feed conversion ratio. As you can see here that on day 21, this combined fume and dawn increased the FCR by 8 points, and this trend continued until day 35, like very similar to what we saw in the previous slide. Here is the necrotic enteritis lesion score. This one, the way we give the score, that the image on your left was scored 1, as the intestinal lumen is filled with lot of mucus. When you look into that middle image, you can see that velvety appearance. That was scored necrotic enteritis lesion score 2. We did not have any intestinal intestinal contents filled with any blood tinged or hemorrhage. So we don't have any necrotic enteritis lesion score. So this fume and dawn combination significantly increased that necrotic enteritis lesion score compared to that control group. But when the birds undergoing necrotic enteritis, this fume and dawn combination further intensified that inflammation compared to that necrotic enteritis group. Here is the histologic image of that fume and dawn. As you can see here that this group is the control group, intact villus with crypt, long crypt. But when the birds undergoing fume and dawn combination, the tip of the villus is gone. But when the birds undergoing necrotic enteritis and when the fume and dawn presents, it completely destroyed that villus. We also quantified that tight junction proteins because they are really critical. These adhesive molecules maintain that adjacent epithelial cells to not to let the pathogenic bacteria or toxins to enter into the circulation. So we quantified these tight junction proteins. As you can see here that claudin, claudin 2 and zona occludin are significantly decreased in the fume and dawn groups compared to the control groups. We also quantified that salmonella load in fume and dawn contaminated groups. In this trial, we used fume 14 ppm of fume and then 0.6 ppm of dawn. To our surprise, the final feed analysis, we noticed that we had some T2 toxin along with neosolenol, some emerging toxins in the feed. So these combinations increased the salmonella load by 1.5 logs compared to that control groups on day 14. So we wanted to know, so far a lot of studies are available about, they reported that subclinical doses of mycotoxins significantly affects that chicken production performance. But we wanted to know what is the dose that will not affect the chicken production performance. What is the lowest dose we can safely feed the chicken. So we did the dose curve response of different combination of fume and dawn, starting from 21 ppm of fume and 3 ppm of dawn combination, and then we went all the way down. As you can see here on day 21, we saw that significant differences between the treatment groups, as that highest combination decreased that production performance than compared to the control groups. We saw the same kind of trend on that day 35, as that highest combination significantly decreased the body weight gain by 132 grams. The other interesting factor we noticed that whenever the dawn combination it was about 2 milligram per kg diet, they significantly decreased the body weight gain by 103 grams and 75 grams, irrespective of fume concentration. We also scored that intestinal lesion score. As you can see here that again, whenever the dawn concentration was about 2 milligram and kg diet irrespective of fume concentration, 100% of the birds, they have that inflammation. But whenever the fume concentration was above 5 milligram per kg diet, 50% of the birds in the treatment had a mild inflammation. So our next question was that, can we know, do we have any biomarkers? Can we identify any biomarkers that can help us to detect the fume dawn during early exposure? For example, currently available biomarkers are, we use spinganin-spingosin ratio. That is one of the gold standard technique. And then other than that, we are using gut permeability and gut inflammatory markers, tight junction protein expression. These are all after the fact, meaning that you have to go and kill the bird, or if you see decrease in production performance, then we can do this. Can we do it in a real-time exposure? For example, in just day 14, if we know that, so that intervention is possible. So we wanted to see whether we can be able to identify some potential biomarkers like microRNA expressions. Like in the other literatures, they have mentioned some kind of microRNA biomarkers in other food pathogens for like salmonella or necrotic enteritis. So whether the same kind of expressions can be showed in that mycotoxin exposure. So this presentation, graduate student, she gave that in-depth presentation on this microRNA biomarkers. We identified 9 microRNAs. They were significant, differentially expressed in the liver as early as 14 days. And the other thing we wanted to see whether we can able to identify serum biomarkers so that we can correlate. We used that wet scan and we quantified some 14 different parameters. With that 14 parameters, we saw that serum aspartate aminotransferase and the creatinine kinase was expressed significantly higher than the other things. So this can be used as potential biomarkers to detect these mycotoxins. But even though we need to do more research to confirm that antagony of this expression of this microRNAs as well as these enzymes. So as I said before this, the birds know the microbes have the ability to detoxify the mycotoxins. Basically, as Chastity said, that this biotransformation degrade the mycotoxins into non-toxic metabolites. This happens within the biological system by enzymes. Basically, these microbes secrete some enzymes. They will detoxify these mycotoxins. The other thing is that the microbes itself, the cell wall, they will bind to the toxins and then they will prevent the absorption of the mycotoxins within the system. So we wanted to know whether the chickens have the ability, chicken microbes have the ability to detoxify these toxins. So I don't want to go too much into that one, but I just wanted to point out that on day 35 data, this is a control group and this is the fume and dawn exposed groups. And this gray box is the Lactobacillus relative abundance. This is the mycotoxin exposed groups. You can see that this Lactobacillus group is significantly decreased in the mycotoxin exposed group. But on the other hand, this blue box is a Clostridiae family. This relative abundance is significantly increased in the mycotoxin exposed group. So the ratio between this Lactobacillus to this Clostridiae family is clearly indicate that the chickens, they don't have the ability to detoxify the mycotoxins. And we all know that the Lactobacillus, they have some ability to secrete enzymes to detoxify the toxins. So in our case, this altered gut microbiome relative abundance involved in or altered that gut mucosal immunity and as well as the decrease in production performance. So this pretty much, Chastity covered this, how we are going to deal with this, mycotoxins. So we have the clay, binders, this probably 1,000 years old mitigation strategy. But with that, we have so many options. As Chastity said, this is really working great for aflatoxin, but not for dawn because of the chemical structure. This is not really a right option when it comes to binders. So this, she already mentioned this. And so we wanted to know that because these mycotoxins decrease to that Lactobacilliaceae family, can we feed these probiotics and then so that the probiotics colonized within the gut and then they can able to detoxify the mycotoxins. So we collaborated with the DSM Firmenich, and in this we saw some promising results, and my graduate student, she presented her research as a poster, and similarly, we wanted to see whether we can supplement some recombinant enzymes to metabolize these mycotoxins. Similarly, this is also that one of the collaborative research, and we saw a promising results with this supplementation. So in conclusion, as I said before, this poultry finished diet is not comes with just a single ingredient. It's a combination of many feed ingredients. So testing just a single feed is not going to give us a full picture of that mycotoxin contamination in the diet. And the other thing is that we have reasonable advancement in the vaccination or biosecurity or disease management. But still there is some room for mycotoxin management to deal with the subclinical risk. And most of the poultry producers know about this mycotoxin and the consequences on the chicken production performance. But the biggest thing is that subclinical dose. That is where, and also that we don't have that proper control or positive control for that emerging mycotoxins. And on top of that, sometimes we see that vaccination failure or some decrease in production performance, we are not correctly linked to that mycotoxin contamination in the feed. So if we can periodically testing this mycotoxin in the feed, and those monitoring the mycotoxins in the flock, that would help us to attain that sustainable poultry production. So with that, thank you so much for listening, and I'm happy to take questions.